we're trying to stay really cutting edge in urology at NUH. We're using the robot in some of our research projects, and two of the studies that are particularly involving the robot are the NeuroSafe trial and the partial trial. And the Da Vinci robot is something that we've had at the trust for a few years, but we've recently upgraded the models and gone from 1 robot to 3, which has allowed us to have the capacity to partake in these trials. But essentially, NeuroSafe is using the robot to try and spare erectile function during robot prostatectomy for prostate cancer. And the partial trial is using the robot to take away small parts of a kidney which are cancerous, but in the same way try and preserve kidney function. So what we're trying to achieve is maintaining people's quality of life while treating their cancer. If we can find a cancer treatment that is just as good as current standard of care or better, but at the same time allow patients to have fewer side effects, that's going to be a sort of goal that we're trying to achieve. I think if you're worried and have any concern about prostate cancer, the first thing is to go and see your GP and discuss it. There's no benefit to anyone worrying at home and not bringing it up. So I would thoroughly encourage anyone to bring it up and have a discussion with the GP. And at the end of the day, but we're here and we will look after you if you need us. Bladder cancer is a really exciting field. Something that I'm getting quite excited about is the new tranche of studies that are coming through looking at immunotherapies in bladder cancer and also genotyping. There's more and more interest and evidence that you can work out whether a patient's cancer is going to respond to certain treatments as opposed to others. And if you can map a person's cancer and therefore their likelihood of responding to a treatment, you can achieve what is essentially a gold standard, which is personalized medicine. And so it means that the days of everyone getting the same treatment are probably over. And actually, when a patient comes through the door, they will have a series of tests which will subgroup their cancer into a specific pathway of treatment, which will be more suitable for them than perhaps another patient. And I think a few years down the line, that's going to be translated into better outcomes for patients.